absolutely. Shall I just introduce myself quickly and just
go
tell
for it.
everyone, because not everybody understands exactly what a trichologist is. So actually, my background's as a hairdresser, and I went into trichology about 5 years ago. And a trichologist actually is a hair and scalp specialist. So we're quite holistic. We're not medically trained, but we look at people's hair and scalp and help them with hair loss, diagnose conditions, and kind of work. We will refer on to doctors and dermatologists as well, because, like I said, we're a lot more holistically based. So,
Fantastic.
in a nutshell, that's basically, we specialise in hair and scalp conditions.
And it's such an interest. I said to you before, if I had known years ago about this, I would have loved to have learned this, because I've just got such an interest in it.
It's never too late.
Yeah. There we go. Well, I'm going to learn a lot today from you, so thank you for that.
Well, I hope so.
Brilliant. Okay, so should we go to our agenda then that we've done? Right, so the first thing we've got here is understanding different types of hair loss. So I will hand over to Lisa to go into more detail about that.
No problem. So hair loss, the term alopecia is basically an umbrella term, and it covers lots of different hair loss conditions. So there's loads of different conditions. The most common are things like telogen effluvium, alopecia areata, female pattern hair loss, male pattern hair loss, and then we've got others like cicatricial hair losses, which are more permanent. And they're things like frontal fibrosing alopecia, lichen planopilaris, and there's loads and loads and loads of others. So one of the most important things to do when you start noticing hair thinning is really to find out basically what condition you have. And it's not uncommon to have a couple of different conditions at the same time. So that's really important, because once you know what type of condition you have, then you can really look at how you can start treating it and what is possible. And some hair loss conditions, we can kind of slow them down and stop them progressing. So obviously the sooner you kind of start having it treated, the better your options are. There's lots of different types, like I said. They can be where you just get like all over shedding, excess shedding. We all know it's natural for hair to fall out. So every time we wash our hair, brush our hair, you always notice some hair in the brush, and the secret is knowing what's normal for you. But if you start noticing excess hair shedding, then it's often for lots of different reasons. So as trichologists, I like to think of us as like detectives, and we look back at the last few years even, and look into why hair loss could be occurring as well. So like I said, it's very complicated. Hair loss is very complicated, and that's why one thing doesn't work for everybody.
Yeah, 100%. I've totally realised that with the comments that I've had from people on my page, is that some things work, some things don't. It can be as simple as like an iron deficiency. It can be something more complicated. So there's lots of different things.
Yeah, it's really complicated. And like I said, the first step is working out what your likely diagnosis is. And then from there, looking at your past history and working out where things, have occurred. So
brilliant. Fantastic. And someone mentioned COVID hair loss. Have you had any experience with COVID hair loss? Or?
Oh yes, yeah. When after we were all locked up indoors for all those months, and everyone went back to work, the hairdressing industry in general would have noticed. Most hairdressers would have noticed people coming back in with excess hair shedding. So COVID hair thinning was really, really bad at that time. And that's a type of telogen effluvium. So it's like excess hair shedding.
Mm-hmm.
And it basically happens for lots of reasons. It could have been stress in general, because obviously it was a very stressful time people were going through.
Yeah.
But also, if you caught COVID itself, you could have had inflammation, a fever,
Mm-hmm.
and just been really, really poorly. So all of those types of things would have had a huge impact on your hair, or could have had a huge impact on your hair.
Yeah.
I think what's really important for people to know is hair is actually the second fastest growing cell in the human body.
Ooh, I didn't know that.
However, it's
Mm-hmm.
not prioritized by the body, because we could all live without our hair, unfortunately. So when our body's under too much stress and it's not in balance, then our body won't send all the nutrients and oxygen and everything to our hair that the hair needs to grow. And because it's such a fast growing cell, it needs a lot of nutrition and a lot of, our body's got to be in balance really to make sure our hair's growing.
Yeah.
And if that doesn't happen, then it will bypass that to make sure our major organs are cared for first of all, and prioritise those.
Yeah, and that makes sense. And just going on from that, like protein, I've been having a lot of protein. I found I had a massive hair boost,
Mm.
when I was having the protein. And for gut health, I heard a lot about it, but I didn't actually take proper notice of it. But gut health is so important for hair growth as well. And I think that was a bit of a shock to me, because I just wasn't expecting to have that hair growth from having extra protein. But I think I read that, like you said, if you're lacking protein, it prioritizes different things before the hair. But if you've got enough protein in your body, it can then send some to your hair as well. So that's probably why you get the boost. I don't know if that's right.
Well, hair's primarily made out of protein, because it's made out of a keratin.
Yeah.
So, which is a protein. So we need to make sure we are eating enough protein so we can make good quality hair. And obviously all the other nutrients we need are really, really important. So,
Yeah.
and especially women as they reach kind of perimenopause years and everything. I know I wasn't eating enough protein. I grew up eating far more carbs and kind of sugary kind of foods. And you get to kind of a certain age and you start, you need more of it. You need to support your body more. So
Yeah, 100%. 100%. And are there any other things on point number 1? Did we cover everything? I can't say that one. Alopecia, hypothyroidism. Did we cover that one? And why?
No, we haven't spoken about that one yet. So I think somebody asked, why does hair shedding occur during alopecia, hypothyroidism?
Yes, they did. Yeah.
So the thyroid is kind of, the thyroid function in hypothyroidism slows down. But to be fair, whether your thyroid's too high or too low, it can affect your hair, both aspects of it. Your hair follicles are very, very sensitive to thyroid hormones. And it often will put your hair into a temporary shedding phase, telogen effluvium, as I've mentioned before, which can lead to increased shedding and changes in texture and density. What I quite often find, and again, subclinical thyroids are very, very common in perimenopausal years. And that doesn't mean to say that your thyroid's kind of not working completely, but it's just not working as well as it was. And very often when I see conditions like that come into the salon, you often see people, their hair's still growing, but it's just not getting into any real length. So it kind of grows, especially around the hairline and, in these little areas here. And it just looks like it's constantly short. It's not staying in the anagen phase for long enough. And it's very, very common. And it's a condition we call chronic telogen effluvium. So it's just the hair's not staying in the growing phase and it needs some support to do that.
Yeah. Okay, I've just seen a comment actually while we're on that subject. Maybe it'd be good. I have telogen effluvium and it's shed. It's shed for 5 months. What can I do now? It's slowing down to thicken it.
So you need to really get down to the reason why it's shedding and not staying in the growing phase. So this is, like I said, as a trichologist, we're like detectives and we look back. So one of the things you could look at is you could look at your blood test results. So when doctors measure your blood test, they will look to see that everything's within range. But they're not looking to see whether it's optimum for hair growth. So sometimes the ranges that the doctors look at, they're quite happy with, but sometimes as trichologists, we look at the whole of your blood test panels that are relevant to hair. Things like vitamin D, thyroid is one we often would check. Ferritin, as you've mentioned before, B12 and folate. They're all very, very relevant to hair, and if they're not kind of closer to the optimal mark, then often that can be the reason for the hair not staying in the growing phase. Stress also plays a huge part. So
massive
part. It really does. Unfortunately, stress is for the whole body isn't great at all. So trying to reduce stress. I've got a pathway that I follow, and the pathway that I follow is very much about the foundations. So things like nutrition, sleep, making sure you're getting an optimum amount of sleep, sort of 8 hours ideally, reducing stress, making sure you're drinking enough water, and movement, all those types of things. Everything we know that's good for us is really, really important. So you get the foundations in place, and then from there I go on generally and start looking at what treatments are, because sometimes just changing the foundations can be enough to get your hair growing back, especially with symptoms like conditions like telogen effluvium.
So. And on that, I've got, as I've told you, ulcerative colitis, which I think has been one of the reasons why I've had a lot of hair thinning, and again to do with gut health and everything, but that is stress related. So when I have a flare up, everything is affected, and I have had a big shed recently, which I put a video on my Facebook page of how much hair I'd lost. But then someone mentioned recently that because I've had the Marina coil fitted, that there's so many different things, and you think, well, is it colitis? Is it hormone? Is it the Marina coil? there's so many different things that it could be. It is hard to pinpoint it, which is why it's vital to have your input and your detective work.
I often think in my work, especially, like I said, especially when I'm working with perimenopause, menopausal ladies, that it's quite often it's not just one of those things on its own. Often it's a combination. With colitis, you don't intake the nutrients quite as well. So maybe your nutrient levels in certain, like your vitamin D, your folate and B12, maybe they're not quite optimum, or your ferritin. So all of those things will have an impact, but maybe not just one of them on their own all the time. So.
Yeah, definitely. Very interesting, I have to say.
Like I said, very, very confusing. And
yeah, it does. And that sort of links on what I just said about menopause. That's our next section, is menopause, thyroid and hormones, which it's quite important for a lot of the people who have been on the Thin Hair Club on Facebook. A lot of comments came through on this. So I'll let you talk firstly, maybe postmenopausal hair thinning.
So postmenopausal hair thinning is often due to the roller coaster of our hormones. So estrogen keeps our hair in the growing phase. And obviously when we're going through pre and postmenopause, our hormone levels are all over the place. So unfortunately that's obviously one of the the reasons why. also some women, if they have the genetics for conditions like female pattern hair loss, androgenetic alopecia, this is quite often the time when that will start noticing as well, because of because testosterone can get a little bit bossier. And so yeah, it's all to do with kind of those sort of hormones and everything, unfortunately. I noticed somebody's just put on there that they've got endometriosis, which again is I believe is an autoimmune condition. So autoimmune conditions alone can create lots of problems with hair loss as well. Obviously, autoimmune conditions quite often have more inflammation in your body, puts more stress on your body and everything. So very similar to colitis and everything as well. So, and obviously has an impact on your hormones. So all the time we got that hormone roller coaster going on. So the best way of dealing with it is, obviously you can seek medical attention, like GPs, to help with your hormones and everything. I can't help you with that, but from a trichologist point of view, what I would recommend for everybody is to go, again, concentrate on the foundations, making sure you're eating well, plenty of water, exercise, reducing your stress, all of that type of thing will help to balance your hormones and making sure you sleep enough. Sleep's when our bodies repair itself, so sleep is really, really important. And again, quite often going through menopause, you quite often don't sleep so well because, you know, hot flushes and all that type of thing. So.
And I think with people, they think, you know, when they hear people say, oh, you need more sleep, you need to eat well, you know, that's more for mental health. They probably don't link it to actually hair growth, and that's probably the missing part, is that actually, for, you know, that is really vital for everything, including hair growth. You know, that part is missing.
Yeah, absolutely. It's really, really important. Your body's got to be in balance, really. That's the way I always think about it. Your body needs to be in balance, and then your hair can grow. So obviously it depends on the type of condition. If you've got other conditions that are more cicatricial, you can kind of, because they start affecting the hair follicles, and the hair follicles with certain type of conditions start dying, you can kind of slow down the hair loss by making sure you're looking at the foundations and looking after yourself, but you can't necessarily bring the hair back that you've already lost. So because cicatricial alopecias are basically kind of autoimmune conditions as well. So so as is alopecia areata. So you know the alopecia areata, where you get the kind of patches of hair loss.
Oh yeah.
They can affect anyone, children as well. I see quite a lot of children with alopecia areata.
And then so that's for a kid. Would that then be down to like stress and food or sleep? Like again, the same foundations for.
Absolutely, all of it.
Oh wow.
Yeah.
I never knew that.
Yeah, no, all of it, unfortunately. So
right. The next thing, I'll let you say this one. Levothyroxine.
Yes, that's right. So levothyroxine is, and I can't say it either, Becky, so just say it really quickly and hopefully nobody notices. It is basically for thyroid. So, I think the person who asked if it thinned hair and what the solutions are. So basically, like I said, it's used for thyroid, and I would say usually untreated thyroid imbalances would cause more hair loss than the medication itself. But obviously when you start using a medication like that, quite often doctors have to change the levels to find out what's best for you. I believe I think that's what I've kind of heard.
Yeah.
So if they give you, maybe it's not enough or it is too much medication, possibly that could affect your hair whilst they're trying to get that dose optimum for you. So really, basically, the doctors really need to make sure that your levels are monitored properly. But also, the other thing I would say is quite often if you have got any thyroid imbalances, then there may be some nutritional imbalances as well. So obviously you want to look at other contributing factors and make sure that your iron levels are good, your other nutrition levels, and reduce stress and things like that in your life, because this all has an impact. And at the time you're not sure whether it is just the medication or whether it's other imbalances that are there as well. So
Yeah.
like I said, hair loss is so complicated, it really is. So
It
you kind
really
of got to look at lots of different things.
And it is like trial and error, isn't it, with things? And you know, it's almost like a tick list you go through and you think, because I have obviously my page and people message me and they say, have your bloods done? And with ulcerative colitis, I'm always having my bloods done. I know that, you know, everything is fine. If it's out of sync for a flare up, then I'm pulled in and it's checked. What I do find is my B12 was seriously low at one point, and I was having injections for that. But then it went super high, and I think the symptoms for high and low B12 are quite similar. So low mood, and you know, so it's quite hard to figure everything out.
It is really funny, actually. In my training as a trichologist, I've noticed. I always thought that all the B vitamins were all we could kind of have as many as we like if you're taking supplements. That sounds a bit silly, but you could potentially have excess B vitamins, as far as I was aware, because you would basically just kind of weed it out if you're not using it.
Yeah.
However, I have found in clinics since I've been a trichologist that if I see people sometimes with really high B12, that can affect their hair as well. Now, I can't. Part of B12, and please, anybody who's watching me who's an expert in B12, please put me right, because I'd love to know. But I have noticed that sometimes really high levels of B12 have affected people's hair, and I do believe that we do store some B12 in our liver. So it could be possibly to do with that. I really don't know, but I haven't managed to find out. Even all the research I've read doesn't pinpoint me the real reasons why that could occur. But I have seen it in clinic on a few occasions, and when people have usually been supplementing with B12, and experiencing hair loss still. And the first time it happened to me in clinic, I was still training as a trichologist, and their own doctor told them to come off of it. And actually, when they came off of it, their hair started improving. So
Incredible.
If everyone takes some notice of this, this should tell you that supplements aren't always the answer. So only take supplements if you really need to, and you know you have a deficiency. Because sometimes, I think, especially for hair loss, people just jump on the bandwagon. Everybody I see in clinics usually taking biotin, but biotin, most of us have more than enough biotin in our diets. And it's a big marketing ploy.
No, I totally get that. And can I just ask something actually off from our agenda? DHT, I don't know how much you know about that as well, but I'm hoping you do. But, you know, is there, when people say to have a DHT supplement, can you take that without being tested for it? Like, can you take that and it does some good?
When you say DHT supplements, are you talking of things like pumpkin seed oil? Like
DHT blockers. So I take vitamins. I take the DHT hair blocking vitamins, which has got a multitude of different things in there as well.
I'd have to look at them in I'd have to look at them really for you, because a lot of DHT supplements contain things like saw, polenta, and things like that. But yeah, no, I don't. I really don't know. I would imagine. I don't know. I'd have to look. My biggest worry is when people come in to see me in clinic, that they're taking lots of things, and actually, when you look at what they're taking, quite often they're taking double the amount of folate that they should do, for instance, or double, and that in itself can be dangerous. So,
a million.
So not with everything, but sometimes you can take too many supplements. So I prefer a food first approach, and then add in supplements when we've looked at blood test results to see whether it's really necessary or not.
Yeah, fantastic. That's really good solution, and it's quite an easy one for people, as a starting point, as solutions go, to actually have that, which is accessible for everyone to do at home, and to be able to look at their diet and make a few tweaks. It is a really good starting point, and something that more people should definitely do. Right, okay. Sorry,
I'm just going to move. No, carry on talking, because I'm just moving around. My phone's just come up. I'd make sure everything else was charged properly, and I'm worried that my phone.
That's brilliant. I've got mine on charge here.
Sorry.
That's all right. Right, so we're doing quite well, actually. By the way, if anyone's watching and they want to ask any questions, feel free. We have got a little agenda, but feel free to pop a little question on like we've had before. Right, so number 3, my favourite subject, most probably, products and treatments that actually help, because I think there's a lot on the market that people are unsure about.
There really are. Oh, it's a minefield, isn't it?
It really is. It really is.
Now, I think the first thing I want to say, sorry, I am trying to get my
Oh, that's right. You get settled. We're fine. We're just going to chill. We've got another half an hour.
Yeah, sorry.
We're powering through.
I made sure everything else was charged up. Okay, didn't think for a minute I was going to use my phone, and then I decided at the last minute my phone was the best option. So
that's right. We've had so much drama with this live. It's actually, I'm just chuffed that I can see you.
Sorry. Right. Okay. So the first thing I want to say on that subject is shampoos are designed for your scalp, really, for your scalp health. Okay, there's very few shampoos on the market that have got active enough ingredients that are really going to improve hair loss. Okay, so they may improve hair loss if your scalp health isn't good enough, then if they calm down your scalp, and that's part of the reason behind your hair loss, it could potentially improve. But otherwise it's very unlikely to.
Yeah.
So like I said, I'm not knocking hair loss shampoos, because they've got a place, but I just think a lot of people think, oh, I just try this shampoo, or I try that shampoo. Unless it's got active ingredients that can get down to the hair follicles, which are sort of fairly further down underneath the skin, they're not really going to do an awful lot apart from keep your scalp health in good condition. So that's the first thing I want to say. The most effective hair loss treatment is, as you well know, Minoxidil.
Yeah.
So, but it doesn't work for everybody.
No.
It doesn't work for everybody. And the other thing I would say is, if you haven't corrected any nutrient deficiencies, or making sure you're eating enough protein and that type of thing, then you might not get very good results from it as well. So there are lots of other solutions you can have as well, depending on the type of hair loss you have. As a trichologist, I am not a prescriber, so I cannot prescribe things, but I do work with a prescriber, a prescribing pharmacist who makes up solutions and everything, so I can pass people over. But obviously there's lots of things you can buy on the on the market anyway, you know, especially things like Minoxidil and everything as well. So, but Minoxidil is probably one of the best research treatments for female and male pattern hair loss.
Yeah.
In general, really. So
Brilliant. I've just seen a comment on there. I have greasy roots and dry ends. How often should I wash my hair? Which is quite an important one, because I've read you should wash your hair daily to keep your scalp really clean and the follicles clear. And then you've got other people who are like, no, wash it weekly. Again, what's right?
there's so many myths, isn't there?
Yeah.
I am a fan of washing your hair as often as you want to. If you think about the skin on your scalp, it's the same as the skin on your face.
Yes, it's an organ, isn't it? I keep saying this, and I think it's an organ.
Absolutely. So it gets greasy, it gets dirty and everything. If you want to wash it every day, it's fine. It's not a problem at all. It's keeping your scalp in good order. If you've got if you haven't got an oily scalp and you're only wanting to wash your hair twice a week, then that's fine as well. I'd probably prefer most people to do it a couple of times a week at least. But I know some people are very lucky, unlike us, that have got really thick hair and it takes them so long to wash their hair. That,
Yeah.
So yeah,
No,
so I completely get that. But
I wash mine sort of maybe every other day. If I'm going out, it is daily, because I use Minoxidil. I do try and do it daily where possible. But yeah, like you said, the good thing about having thin hair is someone can cough and my hair will be dry really quickly. So it's not actually a problem for me to wash it every day. But like you said, people who have thicker hair, it is a bit of a bit more of a task.
Absolutely. I mean, sometimes when if people are suffering with scalp problems, I may ask them to wash their hair more often, so we can treat their scalp. And you know, some people really complain if they have to do it more like every day or every other day, which I get, because if they've got thicker hair than me, but like you, my hair takes no time to dry because it's so fine. I just realised my technical problems tonight. I'm going to move to a different part of my room.
It's good. We get a little house tour.
I can plug it in differently. The plug I was using wasn't working. So.
Oh, it's always the way.
I know. Never mind. Right.
Have you tried Nizoral shampoo? I have that upstairs. That's an antifungal, which you're meant to use like twice a week. I see a lot of people recommend that alongside Minoxidil as well.
Yeah, a lot of people do. If you've got a scalp condition, it can be very effective. But it really depends. It may, on some people, though, dry your scalp out too much.
Right, okay.
So, again, we talk about gut health, skin microbiome and everything. We've got a natural microbiome on our scalp. So, yeah. So if you've got a very dry, itchy scalp or something like that, then it's definitely worth a try.
Yeah.
But I wouldn't recommend necessarily using it all the time, just if you've got any sort of flakiness or anything like that, really.
Yeah.
So.
Excellent. Right. Okay. So on Minoxidil, there was another question, which again I'm sort of interested in because my mum keeps desperate to use Minoxidil. Is there an age? And I don't know, but it's down to sort of more about health, because it is a blood pressure medication. It's just, is there an actual age? Because again, I've seen mixed reviews on this subject.
Yes, it's a difficult one, isn't it? So obviously, if anybody is on any type of heart medication, it's something that I would always refer them to speak to a doctor about. I think there's, yeah, and as you get older, and you know, maybe just refer yourself to the doctor first. Double check with your doctor. Not for under 18, I would definitely say. And also, what was I going to say? There's something else I was going to say. Gosh.
We'll come back to you.
I was talking about, so obviously you can get Minoxidil in topical form,
Yeah.
or in tablet form. So obviously if you're taking the tablet, it's more systemic, so it's getting into your system more. If
Yeah.
you're applying it topically, obviously it has got ingredients that do sink into your skin and everything, but it's not going to be as systemic as an oral one would be. So,
Yeah.
but I would always, if you're ever in any doubt, just ask your GP. Your GP knows your medical history and everything. So,
Yeah,
so just double
definitely.
check with them really. But sometimes I know kind of over the age of, I don't know, maybe sort of 50, 60, you kind of get into that stage where maybe you've got, you know, high blood pressure or something like that.
Yeah.
Having said that, I have even had a few younger people that have tried it and said that they got heart palpitations from it.
Oh,
So
that's the oral minoxidil then?
yeah, no, that was systemic. Sorry, the topical one as well.
Oh, really?
Yeah, yeah.
That's
I
interesting.
recently had a young girl, and she was only in her early 20s, and she'd tried it herself.
Yeah.
And yeah, she'd stopped it because she started getting some heart palpitations. So I think it's really important just to kind of listen to
Yeah.
listen to your own body. Yeah.
Yeah, 100%. And I think, you know, I get asked the question all the time, and I get quite nervous when people see my results and they're like, they straight away just comment on one video, I'm gonna purchase it. And I sort of go into panic mode and I go to them, no, don't. You know, I researched it for quite a few months before deciding to go on it. You know, please research it thoroughly, because it is a long-term commitment, it's a financial commitment, toxic to pets, as we know.
Absolutely.
Oral can have possibly more side effects. So I do sort of try and just say, look, just it's not guaranteed. And I think this is why most people do struggle to make that decision to go on it. Because if it was 100% guaranteed, you know, we'd all have lovely hair, we'd all just go on it, and you know. But there are so many.
There's so many.
Everyone's experience is different.
Absolutely, yeah, hugely different. And like I said, it suits some people, it doesn't suit everyone. So
Yeah,
um,
yeah,
there was another question actually on liquid minoxidil. Somebody obviously has used it and had an itchy scalp from it due to the propylene glycol
yeah,
ingredient. So some people can react to the alcohol in minoxidil, which can cause itching, dryness, and irritation.
yeah,
A lot of the time, a lot of people will fare better with like a foam version, can often be better tolerated. Or the chemist that I use, he can make up different solutions in different kind of barriers, lotions to suit different people as well. So
yeah. And saying that, the one that I use can actually, I think it's called, it's reduced, it's PYP or something free or something that comes. So I can't remember, you know, but it's free of that. So if there
yeah,
are any irritations, it can be tweaked
yes,
um,
absolutely.
accordingly to people, which is really good.
Yeah, absolutely. So yes, sometimes it's just some ingredients that maybe don't suit you. So
Yeah, but I found the foam was really good and really quite gentle. So, yeah, like you said, if anyone is struggling with that, because I think the liquid, I heard, does penetrate deeper than the foam. Don't know if that's accurate. That's what I read. Um, it, I think because of that factor, I think it does penetrate. But so that's why the foam is more gentle. But I had fantastic results on both the foam. But yeah, that's an alternative option for people who are struggling with the liquid.
yeah,
Definitely.
I think if you buy them from you know, a an actual chemist, they can often alter the carrier lotion for you, so and make it
Yeah,
better. So,
brilliant. And while we're on that subject, we have got Rosalina said, I'm 64 postmenopausal, so would minoxidil still benefit my hair?
um, again, really depends on the condition as well, but minoxidil will help because it stimulates the blood supply and everything. It will help a lot of conditions, so we do tend to use that as a first line treatment. Again, any heart concerns, then I would just say pop along to see your GP and just make sure they've got no concerns on you using it at all.
Yeah, and I think the oral, am I right in thinking the oral has to be done by the GP, or and then
probably I would imagine some prescribing chemists could do it as well. I know my prescriber that I use would prefer to only do topical solutions, just because of the extra, you know, problems that could occur. So, but I'm sure it's like lots of things. You can get most things online nowadays, can't you? So,
yeah. Definitely. Oh, she said thank you. You're welcome. I'm glad you're here. Feel free to keep asking questions. Right. Okay. So other products that work other than Minoxidil, do you have any? I know you said Minoxidil is the main one, really, that they've been.
Yeah, I mean there are like I said, lots of others. There's for men. There's, well, even for ladies after postmenopause. For female pattern hair loss, there's things like finasteride and things like that. There's also spirulactone, and yeah, there's quite a few different others. Sorry, I should have got a whole list, shouldn't I?
Oh, that's all right. We can come back again.
If I look on my ingredients list from my prescriber, there's lots of different ones. But
yeah,
like I said, the first point is generally Minoxidil for most people. There are actually even DNA testing you can have done nowadays. So you can have, through my prescriber, you can have a test called Fagron Tricho test, and it looks at you as an individual, and it will say what medication's most likely to work for you. So based on your genetics.
That's really good.
Yeah, so that can save a lot of, obviously there's a cost to it, but over a long period of time, that could save quite a lot of money, because you know what's most likely to work for you.
You'll stop the trial and error bit. And is that a blood test, or is that a swab?
No, it's a DNA test, a swab in your mouth. Yeah, absolutely.
Yeah. Okay, well that could definitely save some time for some people.
Yeah, no, absolutely. Yeah, because not everybody has great results like you have. So
yeah.
But like I said, you know, to get those types of results, you really need to be making sure you're backing it up as well with the foundations. So that's my opinion.
Yeah, 100%. And Lou's just said here, what about the hair serums, Champo and Paradox? Also Viviscal. Now I've seen, again, mixed reviews on Champo. You know, someone said it was fantastic, another person said waste of money. Again, how, you know, have you heard about those ones, and what's your view?
Very mixed reviews. I think it can work for some people and doesn't work for everyone. Some people, you get some really good reviews on shampoos alone. I think one thing I would say is, if you've got a hair loss condition like telogen effluvium, where you've had excess hair shedding, that can be self-regulating sometimes. So for instance, after, I don't know if did you experience anything like that after you'd had children?
I don't think it's really hard to remember, to be fair. I don't think so. No, I definitely didn't have the amazing hair during pregnancy that everyone said I'd get, the glossy, thick hair growth. So that didn't happen. I think, well, I got divorced after I had my second, so I think that's stress related. I had some hair thinning from that. But yeah, I don't remember any excess shedding after I gave birth.
No, so that's a really common one. That's why I brought that one up. Postpartum hair loss is really common for telogen effluvium. And a lot of people will go through that, and then once their hormones all settle down and everything, their hair just starts growing again. So it's self-regulating. And quite often, if you have experienced telogen effluvium in you know, particularly in your earlier years, then maybe it would have sorted itself out anyway, because either the stress has gone, so maybe after you divorce, maybe your hair improved after the stress settled.
Yeah, possibly.
So it can be self-regulating telogen effluvium. If it goes on for longer than 6 months, we tend to call it chronic telogen effluvium. So that's where this is purely my theory of when somebody's used a shampoo or something that's really, really worked and they think their hair's amazing again, quite often it's because it would have temporarily happened and sorted itself out again. So I don't want to, I'm not dissing everything, but I'm just saying sometimes it's yeah, it would have sorted itself out anyway.
Yeah.
So yeah, it's a difficult one.
It is. It's hard.
There's definitely a place for good quality shampoos and things like that. If they help to keep the scalp health in good condition and they calm down inflammation and that type of thing, there's definitely a place for all of these things, but don't expect them on their own to necessarily bring back your hair. If you're not feeding your hair well and you're not reducing your stress levels, then you might just be wasting your money.
And the thing is, hair grows slowly anyway, so the chances are it's not like, you know, you're going to see an instant result anyway from it. It's something that you would have to continue using for a long time before you saw any results.
Yeah,
anyway.
and if I watched something the other day on Instagram, and they were saying within a month my hair went from this to this, but that's not possible.
No.
So don't, if it looks impossible, then it probably is.
Yeah, and as you know, Minoxidil, it takes like 6 months really minimum for Minoxidil. I had really good results, but like I said, I was doing a high protein diet for 3 months prior to starting Minoxidil. So when I was on month 3 of Minoxidil, my hair growth was really good. And I do say to people that wasn't on Minoxidil on its own, that was the two combined, and you know, you have to just wait it out. But again, it's a waiting game, and it's really hard, because I have people messaging saying I'm using it, I'm not seeing anything, and you sort of want to say, well, wait and give it time, but then you might give them that advice and they might you know, 8 months still not see any results. So
yeah, and if they haven't addressed the foundations, then they might never get a result. So
yeah,
and yeah, it's really important. So hair on average grows 1/2 inch a month.
Oh, okay.
So if you think about that, over the course of a whole year, it's only 6 inches.
Yeah.
So that shows you how slow growing hair really is.
Yeah, yeah. And if you've got slow growing hair, and you know, some people do have fast growing hair, but if you, like me, have slow growing hair, and when someone said to me, oh, 11 months on Minoxidil, that's all you've got, I was a bit like, no. I have so many comments of people saying your hair's not thin, it's thick at the root, and it's just here, it just feels more, you know, and it will just get better. You can feel it.
But if you can keep that, if you can keep what's coming through here in the growing phase, then it will get down to here. But if you think about it, 6 months isn't, 6 inches isn't that much in a year. So no. if your hair's down here, that's about 3 years worth of growth.
Yes, exactly. Yeah. No, it's really good to know. Yeah, you've got to be patient with hair growth for sure.
You really have, yeah.
Consistent and patient.
Yeah, it's very metabolically active, but when you want to grow it, it feels like it's very slow growing.
Yeah, exactly. Just a comment here I've seen from Lou again. I've got Minoxidil 0.5 oral from Hair and Me. Would be better to go to a nurse prescriber and get a higher dose. 0.5. I don't know what. I mean, I've heard mixed about Hair and Me, a bit mixed things, but I don't know what 0.5. I'm not good with oral Minoxidil. I know I've got 5% topical Minoxidil. I don't know what 0.5 is.
I don't really want to comment, because I'd always be asking my pharmacist anyway. So I think I'd have to come back with an answer on that one. Sorry.
Yeah. So Lou, I have read that there was like 2% and 5% topical Minoxidil. So from a topical point of view, I do know that the 2% was, you know, deemed a bit of a waste of money, and everyone sort of says 5% for both women and men.
Yes, originally when I very first trained, I was always told that women 3% and men 5%, but now everybody I speak to and all the research I read says that women can safely use 5% as well. So
yeah, so Lou, have a look. I'm not quite sure. I said what 0.5 is. Is that 5%? I'm not quite sure, but yeah, have a little look into that, and
maybe write that one down, Becky, and we can answer that.
Yeah, let me.
If we decide to do it again.
Yeah, 100%. We can look into that and come back to you, because that's a really important thing. And then that's what a lot of people on my page keep saying to me about oral minoxidil, and I really can't speak about it because I've got. But it is an option for people with pets. That's the thing, people do choose oral minoxidil for that reason.
Absolutely.
For pets. Okay, right, what should we... Section 4, this is our, we're doing well for time, actually, and got a few more points to cover. Let me just see if there's any other questions. I think we're... someone said I use Aveda hair thickener spray for blow drying my hair, and I find it really good. Oh, that's good.
Aveda's a great product. I love Aveda.
Oh, yeah. Do you? Well, that's good to hear. Yeah, I love a recommendation. Right, I'm going to write that down as well. Aveda. Right. Right, okay, so tretinoin, again, can we get it in the UK? And is it the same as face retinol?
Okay, so to be honest, this is a little bit out of my remit as well.
Yeah.
So I don't know much about it at all. I did check through the ingredients list from my prescribing chemist, and he doesn't offer it. So then I did a little bit of research online just to check this one out. It's not the same as cosmetic retinol. It's a prescription strength vitamin A, and it's sometimes used alongside minoxidil to improve absorption. It can irritate the scalp though, so it's not suitable for everyone and should only be used with professional guidance. So I would imagine in the UK anyway, I can't say about other countries, but in the UK I would imagine it would be used by dermatologists. Okay.
So. And what's the other one that goes with minoxidil that they say? Tretinoin, there's another one that sort of goes hand in hand. I've had a blank. It'll come back to me at some point. It'll come back to me. I need to think of that one. Okay, so, this one interests me. Red light therapy. I'm desperate to get a red light therapy cap, but they're really expensive. And again, I don't want to waste money if it's not going to work.
Well, I love them. They can be really effective for some people, especially you can use them alongside using minoxidil, or you could just, if it's something you wanted to try on its own because you don't want to try any topical solutions, because you've got cats or dogs or anything like that. So there's a lot of good evidence for low-level laser light therapy in male and female pattern hair loss and other types of hair loss as well. The device quality matters though, so you've got to use the right type of light actually, and I did. So the one I would recommend is the Theradome one.
Ooh, okay. So how do you spell that? Theradome. Theradome.
I mean, there are others as well. I just know that this one, this is actually a trichologist from the UK. She's the kind of distributor in the UK for it. So she's very, very knowledgeable. And it's all about the light strength. So it has to penetrate deep enough to get to the hair follicles, and the wavelength that it needs to penetrate to ideally is 680 nm. So I think some of them, I don't know whether they're all equal. I really need to look at some of the other makes, but if ever I get asked, that's the one I generally recommend.
Yeah, and what's that then? Is that a helmet or is that a brush type?
It's a helmet. Yeah, it's a helmet. So you'd sit there. If you purchase it through a trichologist who have done a diagnosis, I believe that you can, as long as you're proven, you can prove that you've used it consistently, you can get your money back on it after a certain amount of time. So I think it's got some sort of memory in the battery or something, and they know how often you've used it. So you'd be using it. I think they do two different designs, and I think one of them you can, like 2 or 3 times a week, you've got to use it for about 20 minutes. But it's the sort of thing you can sit and do with the TV on. So.
Yeah, definitely. And someone's put here, what about finasteride? That's what I was thinking. I'm sure that's the word I was thinking. Tretinoin and finasteride is the other one. Is that more readily available?
So finasteride is a DHT blocking drug, medication. For women, you wouldn't use it unless you've gone past your post-menopause.
Oh, okay.
Yeah, and there are side effects as well with finasteride and dutasteride as well. So I would be a little bit wary. Yeah, so
interesting. Yeah.
Okay.
Well, maybe delve into that subject another day and have a little look at that, because I'm sure that's going to be of interest to some people.
Absolutely, yeah, I'm more than happy to. If I'm totally honest, I tend to kind of go down more of a holistic route than the medication route.
Yeah.
So my knowledge on medication, it still needs improving. So, but I do have, like I said, I do work with my pharmacist. So if I've got any questions, I just ask him.
Yeah.
If anybody wants anybody, because it's not my area of expertise at all. So.
No, totally understandable.
So yeah, and it because I'm not a doctor or anything like that, I haven't got medical background. I kind of tend to sort of pass over to my prescribing chemist rather than deal with everything.
So careful.
Myself. Absolutely, yeah.
So. Okay. Right, this one, latanoprost. That's it, right?
Latanoprost, yes. So this is quite an interesting one that was developed for glaucoma treatment. You know, and
for the eyes.
Yeah, absolutely. And it was noticed that it stimulated eyelash growth.
Okay.
So there's a lot of research going on to scalp hair growth with it at the moment. But it's not considered a standard first-line treatment. And I know, looking at the ingredients list from my pharmacist, that it is very, very expensive. So obviously using it just for your eyelashes wouldn't be too bad. But if you're thinking about the whole of your, even just the top of your scalp, the cost of it for using it for your scalp could be very, very expensive. So
right.
I had a hairdresser actually today. Claire, she might even be watching. So Claire, if you're watching, hi.
Oh, hi, Claire.
She messaged over and she'd found some hair growth with UK Lash, I think it was. So I did look into their ingredients. They don't look to be actually losing latanoprost. Can never say all these words. But their ingredient list was quite interesting, but I'm not sure. I'd like to look at more research to find out how effective their product will be. So, but yeah, so it's emerging new research, but there's not been enough done for the scalp at this moment in time. So
yeah, okay, fair enough.
There's some lots of interesting things coming out and about though. So. Lots of new research coming out, so I'm very interested in kind of stem cell technology and
that PP405 that I did a video on.
Oh, I didn't see your video. So
yes, someone mentioned PP405, which is like stem cell level.
Yeah.
But it won't be out until 2028, I think. So a little way to go. But yeah, that would be interesting. Again, I think it's a topical application.
Yeah, there's some really interesting things that are apparently kind of on the go at the moment. So it'd be interesting to see what the next few years brings. So I'll probably be retired by the time that all happens. But,
No.
but yeah, no, it's good.
Well, hopefully you will. Right, okay, so the last one on our list, oh gosh, I'll let you say this one.
The spirulactone.
That's it, spironolactone, pros and cons.
Yes, so again, this is a prescription anti-androgen medication, sometimes used for hormonally driven female pattern hair loss. Can help to reduce shedding and slow thinning in some ladies. It does require medical supervision generally. And again, you can have this in topical or oral form. So I think the medical supervision would definitely come in with the oral form. I know my pharmacist will prescribe this one topically. The feedback that I have on it is it smells quite disgusting. Some people can't handle the smell. But yeah, like I said, you can have, if it was through like a dermatologist, I've met a few ladies that have had it prescribed from them through a dermatologist or through their GP, and they've had it orally. And I think it just, you kind of need to monitor the side effects like dizziness, breast tenderness, and changes to blood pressure again as well.
And can that be used alongside minoxidil, or is it one or the other?
I mean, with a lot of these, especially topical solutions, you can mix them up. So again, I notice with my prescribing chemist, some solutions he can mix together, and you can have combinations of them. So yeah, you could mix them up. So if you wanted specifics, I'd have to look at his list, but I can again, any questions you've got like that, if you want to do another one of these, we can answer those types of questions then.
100%. It's really interesting. And I had someone comment to say they were on oral minoxidil and topical minoxidil and something else, and I was like, oh, I didn't realise that you could.
No,
it was prescribed for them by GP or someone, but yeah, I didn't realise that. So
no, I think for me that would worry me a little bit, but if it's prescribed by a dermatologist who's somebody with a medical background who really knows what they're doing, then that's fine. But I personally, like I said, I haven't got enough knowledge really of medication and I wouldn't feel confident prescribing things myself, and obviously I'm not able to because I'm not a doctor or a chemist. So
and a lot of people don't really like to take medication, and I've had questions, what alternatives can I use to minoxidil, and just going back to people who have just joined us, who weren't at the beginning. Your main focus is the holistic way. It's diet, it's sleep, it's everything like that as a starting point.
Absolutely, and then you can use other things to kind of stimulate stimulate the blood to get to the hair follicles. So you can use. There's been a little bit of research, and I don't say take it with a pinch of salt, but things like rosemary oil can stimulate the blood supply to your hair follicles, as can caffeine. So if you look for ingredients in a shampoo that have those types of ingredients in, then it may help stimulate the blood supply, especially with a good head massage alongside.
Yeah, love a good head massage.
Absolutely. It's one of the best ways to, massage yourself, stimulate the blood supply. It's all going to help. And basically, if you think about minoxidil, that's basically what it's doing. It's widening the blood vessels so it can carry nutrients and oxygen to the hair follicles.
Yeah, that may have been miniaturized, not necessarily completely dead, but you do think they're completely dead when you do get hair thinning, but they have just maybe gotten smaller.
Yeah, absolutely. And they need to grow. I always think of hair as, if you think of like little tiny trees when they first start growing, they're really thin and spindly. Yeah. And you need to get them growing for longer. So you need to keep hair in the anagen, the growing phase, so they grow for longer. and then they start getting thicker, and
Yeah.
they go on like trees do. So.
Yeah. And just one last thing, I'm just covering because of what I do dermastamping ahead of using minoxidil.
Yeah.
And I do say to people various things. I think titanium needle is really important because they're stronger. Not to go too high with the needle length as well. You've got to, I think it's 0.75 the highest I go, because you can cause damage and scarring, which will obviously have the reverse effect.
Absolutely.
And
But
like twice
that's
a week
great.
maximum.
Yeah. So the reason that type of works so well, a lot of people start off with even smaller needles, don't they? And then they
100%, yeah.
Yeah. Did you do the same?
I did. I was very nervous, and I left as instructed, like 24 hours between using minoxidil, just because I wanted to know whether my scalp could handle it. And obviously, 11 months on, I know I can. So I leave about 15 minutes maybe, and then I put the minoxidil in. But yeah, for anyone starting off, definitely leave a long amount of time just to see how your scalp reacts to the derm stamping, because I think you can go into more detail, but it creates micro injuries.
Absolutely, yeah.
And then the minoxidil can travel in.
Yeah. So basically, what happens is in our body, if you think about cutting yourself, how your body repairs the cut, and it creates lots of, like you said, little micro injuries, and then the blood supply, the little soldiers and everything go in there and they fix that little cut together. So basically, by doing the same type of thing in your scalp, you're creating little tiny injuries.
Yeah.
And it's getting the blood supply to go back and repair that area. So that's why you don't want to go too deep. You just want to be just deep enough just to create little micro injuries, and that's how it helps. So
yeah, perfect.
It just allows that to penetrate, but it also gets that blood supply in the area that you want it to be.
Yeah. Well, as I said, I've had fantastic hair growth from finally looking after my hair after years of not really caring about inside and outside. So it's definitely helped.
Yeah, no, it's great. I've been watching your journey, and you can really see a difference in your hair. So
yeah, my hair isn't this long, guys. I've got my OG ponytail in, so it's not actually this long. It hasn't grown this long with minoxidil, but definitely at the roots. And I have found my scalp is a lot spongier. It's I think when I first started, it was almost like as hard as a table. It was like skin and bone almost, but now there's like a spongy element that I can feel underneath.
yeah.
So I feel that might be the blood.
Did you used to get a lot of tension in your scalp as well?
Yeah, so when I do my my head massage, which I use the skin over scalp method to massage, at first it felt very tight. Now I've got sort of lots and lots of movement with that, and it does feel, the whole area just feels totally different to how it did before.
That's brilliant. Really good. Yeah.
It's interesting.
Yeah, very. Yeah. Yeah, we could talk all day.
We could, but we are out of time. But thank you so much, Lisa, for joining us and answering those questions. I will save this live and put it onto Facebook for everyone on the Facebook page as well. And yeah, I'll do a little message out to see, or anyone here really who found it interesting, if this would be something you'd like to have more regularly. We're happy to do sort of a monthly session. Thank you both. It's been really helpful. Oh, brilliant. Any questions, message me directly, and we can look into it in more detail or cover something in more depth if that helps.
Yeah, more than happy to. That's great.
Thank you, everyone. Thanks, Lisa. We got it working.
At last.
At last. Well, have a lovely evening. I hope everyone has a lovely evening. And yeah, we'll see you soon.
You too. You take care. Thank you.
All right. Thanks, Lisa.
Bye.
Bye.